And this is all new here on the News at 10. The federal government is funding rural health care in Idaho. Altogether, 5 organizations received more than $3.5 million to improve health care access in various communities around the state. News Channel 7's Abby Davis spoke with leaders in one of those organizations about how the money will impact their mission. Abby.
Shira, this funding is not just for healthcare providers in Idaho. 37 states are actually getting money through the American Rescue Plan Act, which the United States Congress passed in March of 2021. In total, the federal government is giving $74 million to these states. Here in Idaho, Reilly Health Services is using its $1 million grant to reach the community in Homedale. Healthcare access in rural communities is something Reilly Health Services employees are passionate about.
It's part of our mission and why we get up and work in healthcare every day.
There's a wide range of services that are needed: medical, dental, mental health.
Reilly received a $1 million grant from the federal government focusing on just that. The organization is using the money to build a new clinic in Homedale, a town of about 2,600 people. CEO Heidi Hart and physician's assistant Janine Franco say receiving health care in a rural community like Homedale is sometimes challenging.
The farther away people live from metropolitan or more urban areas, you start to have access issues and challenges, transportation issues and challenges.
For people who travel is difficult, it's nice to have a community available or a clinic available in their community.
Currently, Reilly and Homedale is split between 2 different buildings. This new facility means everyone can work under the same roof. Hart says they are also expanding their services.
New for this building, however, will be the addition of pharmacy services, so that at the end of the day, we will have medical, dental, behavioral health, patient navigation.
Right now, Reilly serves about 1,800 people in Homedale, a number Hart says she hopes to increase.
Really, it's about our ability to expand and make sure that the other people that live in Homedale also have the ability to get their health care needs met.
The new clinic will cost $2.6 million. Right now, Hart says they still need about $600,000. In the meantime, Franco says the community is anxiously waiting.
We don't get a lot of new things in Homedale, so it is pretty exciting that will be available.
Again, Reilly isn't the only provider in Idaho receiving funding. We have a complete breakdown of the other healthcare providers at KTVB.com. And by the way, there's a groundbreaking for Reilly's new clinic on Wednesday. I'm told they hope everything is completed within the year.
Yeah, definitely a needed resource. Thank you, Abby.